we have been able to see more awareness from providers, which weren't necessarily having those conversations with patients before. Definitely more community engagement, more willingness to talk about advanced care planning than what we've seen, and just really being able to ease that conversation in that was definitely a struggle before and almost seen as taboo. So glad to have seen some type of transition within the community. As you know, all programs, you would like to see more of it, but we have to take the good over the bad. So definitely, and with the amount of people that we've had to actually visit our website, take a look at our materials, at least identify a proxy on mydirectives.com has been a good turnaround that we've seen. So it was really our group within the 6 hospitals of Montgomery County. We have our Nexus Regional Partnership that really sat down to take a look to see specifically what the needs were in the county, what our needs were for our population, to see what kind of targets are there, to see how we can better help folks within our community. So in 2018 is when the program was fully developed, in the sense of getting together different stakeholders from religious groups to community groups to the hospitals to our safety net clinics for our uninsured, undocumented population within the county, and really getting a think tank together to see, what is needed, how can we make this better, and what resources can we put in place. So when we initially started, it was just okay, advanced care planning. So we didn't have a logo, we didn't have a name for it, we didn't have anything. So we created what was called a steering committee. So there was at least one representative of each of the community groups within the organizations that we were partnering with. So it was about 17 members total on the steering committee that really sat down and worked on the branding and worked on the mission and the goal for the program and worked on the name. So we created a program called Voice Your Choice because we felt like it was very staple in the sense of making sure that everybody, was able to get their voice across. And so our main mission was to really motivate people to express and document their healthcare wishes in the event that they can't speak. And then our true vision was to be able to put people's healthcare wishes out there to be known and honored, so that way when they can't speak for themselves, at least there's something written down that we were able to put forward that was easily and readily available. We did have a couple of in-person trainings, which was considered train the trainer, where we would have people from those different community organizations and different community groups that spoke different languages to really go through the material with them to talk about specifically, what is advanced care planning, how does this work, and kind of go through the steps. And so they were then um, sent to head out to work with groups in their community to relay the information and train them. And then we also worked with our partner, which was JESSA, the Jewish Social Services Organization, who helped us put together our local community trainings. So specifically, they were holding the trainings at their facility. And so we had a trainer that would go to their facility and would have folks come in from the community. It could have been, all different age ranges. It wasn't any specific. They just had to be 18 years of age or older. And they would come to those trainings, and we would have somebody that would walk through and just say, what is advanced care planning? How does this work? What are your wishes? And they would sit down with them, and everybody would view the presentation. And then once they were done with the presentation, we had our website, mydirectives.com. They would actually allow them to go to that website And then once they go to the website, they were able to help them with logging in, creating a username, a password, and just getting them initially set up. They didn't have to make any plans at that point in time, but just really getting them set up in the system. So that way, when they had that conversation with their family member to say, I'm putting you down as my proxy, or I'm identifying these wishes. They could go back with that username and password that they've already created, and then be able to log in and know the steps that they had to complete in order to get that advanced care plan in the system. The initial part was our real big community focus. And then our second part that we rolled out primarily in 2020 into 2021 was our provider focus. So really, providing resources to providers that were in the hospital, but also in the community, making sure PCPs were equipped with the educational resources, or also just understanding how to have the conversation. So we put some resources together as well for providers at voiceyourchoice.org, which is our website. And then the educational links are embedded into the website. So providers can click on the provider tab that's located in the website, and they're able to take a look specifically to see, like, how do I have this conversation? What resources are available to my patients? What is advanced care planning? How do I bill for it? How does this make a difference with COVID-19? And then also making sure that we had things in place so that way, if there were conversations or questions that providers may have had, that we were also accessible to them too, so that way they could call us and say, hey, I have a question about this. How do I cover this conversation? Or where can I find this resource at? So also being readily available to them, so that way they were also able to go online and print out collateral, or we could give it to them for them to be able to share with their patients as well. I would say having hospital involvement. With Montgomery County only having 6 hospitals, every single hospital was involved. Every single hospital had a board member on our steering committee. So it was essential that we got their buy-in, because they're the ones that are serving our population within the county the most. So that was very important to have them to be able to have a voice. That was a part of driving this, because they were really the ones that, they have the population, they're seeing the patients, they're the ones that are able to make these connections and have a lot more attachment to some of the resources than we do. And then also getting our community involved, like, at the church level. We had people that were doing trainings within this church, and that's one of the things too, is that, talking about death and dying is viewed very differently in different cultures. And so just being able to connect on a culturally sensitive level was very important as well to make it successful. My advice would be to start in the community, really get that community buy-in, that community understanding. And then hopefully, if there's a larger organization you're trying to get to, that community input will help it when you bring it to the table. Um, but don't get discouraged, don't give up. It is a long process. It doesn't happen overnight, even though our program's been going truthfully since 2018. Um, but hasn't been going since 2018, but at least the initial startup, there's still hiccups. There's still, where are we getting funding from? There's still, those issues that necessarily never go away. But it's just being a little bit easier to navigate it as you go on through time. And also with an increase of notoriety and resources that are available, and just folks having a better understanding of where you're coming from.